Good evening, medicos. Welcome to Medical Students Corner. Today is our ECG session. In the last session of ECG, we were discussing about the anatomy and physiology, which is very essential in order to understand the ECG completely. So, from today, we are entering to the ECG proper. We are discussing about the standard 12 lead ECG, which are in practice nowadays. Okay, so in this class, we are going to discuss about the difference between electrodes and leads in an ECG. So, you just understand electrodes are the things which are placed in the surface of our body in order to record the electrical activity of the heart. You understand? So, these electrodes are placed on the surface of our body. The things which are placed in the surface of our body is known as electrodes. So, we will see what are the electrodes which will be placed in the 12 lead ECG. Okay, so electrodes. We are discussing about 12 lead ECG. Electrodes. So, in between this, there are other types of ECG also, which we will be discussing in the upcoming session when there is need. So, we will be concentrating on the standard 12 lead ECG in the following sessions. Okay, so electrodes. So, what are the electrodes which are placed in the surface of our body in case of 12 lead ECG? We will see. So, there are 4 limb electrodes, okay, and the limb electrodes can be identified by the marking in the electrodes. So, there are 4 limb electrodes. They are RA, RL, LA and LL. These are the 4 limb electrodes. This RA, it is the electrode which is placed in the right upper limb. Right upper limb. RL, this is the electrode which is placed in the right lower limb. LA, this is placed in the left upper limb, and LL, it is placed in the left lower limb. You understand? And the importance here is only 3 electrodes. It is we will be seeing. Okay, we will be seeing in the ECG. What about this right lower extremity electrode? So, this is the neutral electrode, okay, which neutralizes the electrical activity of all the leads. So, this is the neutral electrode, and these are the functional electrodes. Okay, then these are the 4 limb electrodes, and there are 6 chest electrodes, that is V1, V2, V3, V4, V5 and V6. These are the chest electrodes. So, in some books it is said that there are 6 chest electrodes, and in some books it is said that there is only 1 chest electrode which is placed in different angles in the chest. Anyway, ECG made easy by Hampton says that there are 4 limb electrodes and 6 chest electrodes. So, in total, in a standard 12 lead ECG, there will be 10 electrodes. You understand? 10 electrodes. Then, regarding the leads. So, leads. What is mean by leads? The electrical activity. So, what is the role of this electrode is, or what is the role of this ECG is? It will be comparing the electrical activity of the electrodes. You understand? So, like that, leads. So, we know that in 12 lead ECG there will be 12 leads. You understand? So, leads are the electrical activity which is recorded is known as lead. Electrodes record the electrical activity, and leads are the recorded electrical activity. Understand? You got the difference? Any doubt? Please let me know in the comment box. We will discuss again, no problem. But you understand? Electrode records the electrical activity, and the recorded electrical activity is the lead. So, there are 12 leads in a standard 12 lead ECG. The name itself signifies there are 12 leads, is it not? So, the 12 leads in a 12 lead ECG are AVR, AVL, AVF, lead 1, lead 2, lead 3, lead V1, lead V2, lead V3, lead V4, lead V5, V6. So, 6 plus 6 is equal to 12 leads. Understand? So in a standard 12 lead ECG, the electrodes are 10 and leads are 12. In some book it is said that there are 5 electrodes. You leave that. You just remember like this. You understand? Okay. Okay. So we will see the limb leads in detail today. Okay. So regarding the limb leads, we are now not talking about the electrodes. We are talking about the leads. Okay. In the following session, we will be talking about the leads only and not the electrodes. You just understand? Electrode will be talking about the leads. Okay. Hereafter. So regarding the limb leads, today we are going to discuss about the limb leads. That is these leads. About these leads we are going to talk. So there are 2 types of limb leads. That is unipolar leads, unipolar limb leads and bipolar limb leads. So regarding the unipolar limb leads includes AVR, AVL and AVF. Okay. So this unipolar limb leads includes AVR, AVL and AVF. Here A stands for augmented, augmented. V stands for unipolar and R, L and F. It stands for the side which is connected, side which these leads are recording. You understand? So this is the full form. A stands for augmented, V for unipolar and RLF for the side which is connected. See, this limb leads, it records the electrical activity which is towards the right shoulder, left shoulder and also left groin. So we can place the electrodes anywhere just below the area, and usually it is placed the right arm. Right arm lead is placed just above the right wrist joint, left arm just above the left wrist joint and also left foot. It is just above the left ankle joint. Like this it will be placed. You understand? And regarding the unipolar leads, there will be only one pole. That is this side or this electrode acts as the electrode which is placed acts as the what? Positive area. Electrodes consist of 2 areas, is it not? Positive and negative. Here this this electrode acts as the positive area and the electrical activity which is produced by the ECG machine acts as the negative area. Understand? Yeah, this is regarding the unipolar limb leads. Then regarding the bipolar limb leads, bipolar limb leads includes 1, 2 and 3. So regarding the bipolar limb leads, it will be seeing or it will be comparing the 2 unipolar limb leads. You understand? Bipolar limb leads, it will be comparing the 2 unipolar limb leads and also it consists of 2 pole, 1 positive pole and 1 negative pole. You understand? So in unipolar limb leads, the positive lead is the electrode and the negative pole will be the ECG machine, electric activity produced in the ECG machine. But in case of bipolar limb leads, it will be comparing the 2 unipolar limb leads and the one will be acting as the positive electrode, positive pole and other will be acting as the negative pole. Understand? So suppose we will see what is the positive pole and what is the negative pole in bipolar limb leads. So suppose this is a person. Okay, just imagine this is a person for studying what? ECG. Okay, so this is the right side of the person and this is the left side of the person. So here this is the right arm, this is the left arm and this is the left foot. Okay, okay. So here we all know that this AVR will be placed here, AVL will be here and AVF will be here. Okay, so we will see about the bipolar limb leads. Here the lead 1 will be connecting like this. Okay, lead 1 connecting like this, that is between right arm and left arm, right arm and left arm. Here the negative pole is the right arm and positive pole is the left arm. As regards to this lead 1, bipolar limb lead 1, it connects right arm and left arm. Right arm is the negative pole and left arm is the positive pole. Understand? Next, lead 2. Lead 2 connects right arm and left foot. Right arm and left foot. Lead 2. Here, left foot is the positive. Left lower extremity is positive and right arm is negative. Understand? This is lead 2. Next, lead 3. It connects left arm with the left leg. Left arm with the left leg. Okay. And here again, left lower extremity is positive. Left leg is positive and the left arm upper extremity is negative. Understand? So, these are the bipolar limb leads. So, today we have seen about the difference between electrodes and leads. What are the limb leads? What are the chest leads? About the detail of the limb leads. There are two types of limb leads, unipolar and bipolar. Unipolar, AVR, AVL, AVF. It is known as unipolar because the positive pole exists in the electrode and the negative pole is the negative energy or electrical energy created inside the ECG machine. And this bipolar limb leads, three types are there and it connects the unipolar limb leads. It compares the electrical activity produced by the unipolar limb leads. Lead 1 connects right arm with left arm and the negative pole is right arm, positive pole is left arm. Lead 2, right arm with the left lower extremity. Right arm is the negative pole and left foot is the or left lower extremity is the positive pole. And lead 3 connects left arm with the left leg. So, here left arm is the negative pole and the left foot is the positive pole. So, in the next session, we will be discussing about the chest leads. Okay. So, hope you understand. If there are any doubts, please let me know. We will discuss again. Hoping for your support. Please subscribe. Please share. Happy learning. Thank you so much.